Hi everyone, thank you for joining us today. My name is Bree Flanagan and I am one of your public health educators here at Caldwell County. I am joined today by Kara Green. Kara, would you like to introduce yourself?
Yes, of course. My name's Kara, like you just said. I am a public health nurse here at the Caldwell County Health Department. I'm here to talk about vaccines today because August is Vaccine Awareness Month. So I'm going to answer some questions that Bree has for me.
All right, perfect. Thank you so much for being here. My first question is, what are vaccines and why are they important?
That is a very good question. So vaccines, they are a specialized medication that they help your body learn how to fight off certain illnesses before you ever get sick. They don't make you sick, they just help prevent you from getting sick. So what it does is it gives you a safe, small copy of the germ, and your body will build antibodies, and it will help you learn if you ever come in contact with that germ to learn how to fight it off. They're so important because they help prevent the spread of illness and prevent people from getting severely sick where they need to be hospitalized.
Okay, so they prevent both the rate of the spread, right, and the severity of the illness?
Yes,
okay.
Yes, that's correct.
Okay. What types of vaccines are there and how do they differ?
Okay, yeah, good question. So there are 4 different types of vaccines. The first type I'll discuss is live vaccines. So with live vaccines, it is a small, very, very weak live version of the germ. It's introduced to your body. It's not strong enough to make you sick or anything. But with that small little copy of the germ, your body will learn how to fight it off. If you ever come in contact with, for example, like chickenpox or MMR, like measles, mumps, and rubella. So that's what the live one does. The second one is a non-live vaccine. It's an inactivated form. Pretty much with that form of vaccine, the virus is completely dead, but it can, with that virus being introduced to your body, it can still help you learn how to fight off that illness. And our third form is the subunit vaccine. What that does, it just has a little piece of the germ. So it's usually like the shell, like just a small little piece, but with that small little piece of information, it helps your immune system learn how to fight off the illness. Our fourth one, it's a fairly new one. It's seen in the COVID vaccine. It is an mRNA vaccine. Pretty much with that, instead of giving a complete copy of the germ, it provides steps on, kind of like instructions in a recipe on how to fight off the illness. So those are the 4 types that we know of right now. How they all differ is there's just different ways of that they approach the body in fighting the illness, but they're all the same effective-wise. They all help prevent the illness and the severity.
Okay. Would you say there's any difference in the effectiveness of the different types?
I wouldn't say so. I think it all just has different approaches to how it fights off the illness. So they're all the same effective-wise. I wouldn't say there's one that's more effective or less effective.
Okay, great. That's good to know. What are common side effects of vaccines and when should people be concerned?
Good question. Another good question. Common side effects are fever, soreness at the injection site, redness, swelling, body aches, headaches, just feeling overall kind of icky, when you feel sick. All those side effects are completely normal. That's from where our body is learning how to fight off the illness. That means your immune system's working. And side effects that would be concerning, I would say, would be you're having trouble breathing, there's swelling in your face or your lips, anything like that. You have a rash that's all over your body. Those can cause for a concern. Usually, we know of those severe side effects right after we give the vaccine. So, say if something like that were to happen, you would be around healthcare providers who would know what to do. But those are the ones that are more severe. But those are really, really rare, those complications. I've worked at the health department for almost a year, and I've yet to see, knock on wood, any kind of side effects like that.
That's great. That's really good.
Yeah.
Would you say there's anyone who it's not safe for them to get vaccinated, or do you think it's pretty much safe for everybody?
So that's another good question. They are not safe for everybody per se. The certain people who cannot have any vaccines are usually those who are severely immunocompromised. For example, like if you have cancer and you're going through chemotherapy, the chemo suppresses your immune system, so your body can't fight off those illnesses. So getting vaccines would be very harmful for them at the moment. But all of those healthy individuals who can have the vaccines, we do encourage them to get those.
Does it make a difference for people who are healthy to get it? Does it help people who can't get it stay healthy?
Yeah,
well?
yes,
Okay.
yes, because it can reduce the spread of that illness if everyone has the vaccine.
Okay, so you're not just protecting yourself, you're protecting others as well.
That's correct.
That's great.
That's correct.
So what happens then when vaccine rates drop in a population?
Oh, yeah, that can cause some great concern. So there's a lot of negative outcomes if there is a decrease in vaccination rates. More so because there's an increased risk of the disease being spread, and that means more people having it. And the increased risk for those who can get severely sick from the illness, because those like babies and the elderly, and especially those going through chemotherapy, they can't, they don't have the strong enough immune system to fight off these illnesses. So it's very important for others who can get vaccinated to get vaccinated to protect those, because it can have extreme negative outcomes for those who can't be vaccinated and develop that illness.
Okay, that's great. So what can local health departments and the media do to fight misinformation that might be out there about vaccines?
Oh, no, that's a good question. Definitely, at healthcare providers, at the local health department, or any clinic or doctor's office, it's important to provide factual information from reliable resources about vaccines. And when parents have questions, to answer them the best of your ability, of course, and provide it in simple terms and with factual information, to reduce any fears and anxiety in parents or any older individuals as well who need certain vaccines. And for the media, I think something that's important for them to do is also not to spread any fear or misinformation, and provide all the facts about vaccines and how they can be positive for the community.
Okay, and a great local resource is always your local health department.
Yes,
right?
correct.
Yes. That's great. So what vaccines does the health department offer?
Oh, good question. So we offer all required vaccines. Like, for example, this month kids are going back to school, so we have all those vaccines that kids need to go to school, like Tdap, MMR, varicella, just a couple to give examples. We have those, and we also have some ones that are not required for school necessarily, but we have them as well, like hepatitis A, we have meningitis B, and the HPV vaccine. We offer those as well. And we also have seasonal vaccines that will be available here in the coming months, like the flu, COVID, and RSV vaccine. So, the RSV vaccine is a new one we're introducing. That one will be available around October, we're estimating, and for flu and COVID, we're hoping maybe around mid-September to October is when we'll get those in. So if you follow us on any form of social media, you'll see any updates about when those will be released, and other events like our local flu drive.
Okay, great. Thank you so much, Kara. That's all the questions I had for you today. Is there anything else that you think is important for the community to know?
I think it's definitely important to just follow us on social media. And if you have social media, not everybody does. For our next events, and for example, when our next vaccines will come out, that's where we usually post all of our information.
Okay, great. Thank you so much for answering, Kara. And before I let you guys go, I wanted to mention that we are completing our community health assessment surveys. So that's just a chance for you to tell us what you think is going on in the community and how we can best serve you. So that'll kind of give us guidelines on how to plan our future programs. So you can find that on our social media pages as well as spread throughout the community. So go and fill those out so we can hear what you have to say. Thank you so much again, Kara, and thank you guys for joining us. We'll see you next time.